In difficult situations, several things are crucial. Making the right decisions, choosing the right words, and collaborating smoothly as a team every step of the way. For more than 25 years, we at the Heart and Diabetes Center North Rhine-Westphalia have been making it possible to treat cardiovascular and metabolic diseases under one roof. A plus for our patients who profit from this holistic approach. Here in Bad Oeynhausen, 4 clinics work hand in hand. The Clinic for Thoracic and Cardiovascular Surgery, the Clinic for Cardiology, the Center for Congenital Heart Defects, and the Diabetes Center. Developed consistently throughout the past 25 years, the success of our integrative concept has steadily increased, enabling the HDC to achieve its current status as an international leader. Cardiovascular diseases and diabetes are often reciprocal. Most diabetes patients develop cardiac and vascular problems, while many patients with heart diseases are also diabetic. For this reason, treatment and therapy concepts at the HDC are developed jointly by heart specialists and diabetologists. The idea is to break the mold of individual disciplines and view patient treatment holistically. The HDC favors innovative treatment methods and an integrative nursing and therapy concept which takes into account all facets of the disease. In our foot center, for example, concomitant symptoms like diabetic foot syndrome can be treated without delay using state-of-the-art medical techniques. Last but not least, this close interaction between the various HDC specialists is facilitated by ultra-modern technology. The team responsible for a particular treatment can access all the necessary data from secure system points within the hospital. The latest imaging techniques mean that many treatments are now possible without invasive surgery. A development which saves patients a number of unnecessary interventions, and one which vastly improves results if surgery should prove necessary. One example is bypass surgery. Using imaging techniques, the HDC has developed a unique procedure to determine preoperatively the precise location for a bypass. Our physicians have at their disposal technical equipment of the highest global standard, creating ideal conditions for sustained therapeutic success. In the case of surgical measures, the HDC also favors interdisciplinary cooperation. One example is hybrid interventions in the catheter laboratory, performed jointly by a cardiologist and a cardiosurgeon. This mighty team of clinics is supported in its work by a host of separate institutes. For example, the Institute for Laboratory and Transfusion Medicine and its University Blood Transfusion Service OWL, one of the 2 largest university blood transfusion services in Germany, producing a continual and sufficient supply of blood products. Or the Institute for Anesthesiology, specializing in gentle anesthesia techniques. Or the HDC Tissue Bank, responsible for a continual supply of human heart valves. Our integrative approach at the HDC also benefits the very smallest of patients. In the Center for Congenital Heart Defects, pediatric cardiosurgeons and pediatric cardiologists work together very closely. Complex heart defects are treated and healed in an atmosphere conducive to playing, learning and relaxation, totaling over 7,000 cases a year. This makes the center a global leader in its field. For all its state-of-the-art technology and innovative treatments, at the HDC NRW, the focus is always on the person and the relationship between staff and patients. An experienced and excellently trained team of therapists, nurses, psychologists and nutritional experts is in place to support patients and provide qualified guidance in this exceptional situation. Advice and help from the start. Experienced nursing and competent therapy. An open exchange of information and expertise. And last but not least, an atmosphere which makes each patient's stay in hospital as pleasant as it possibly can be. A major plus at the HDC is the fact that scientific research and medical care are so closely intertwined. This gives rise to continual and often pioneering improvements in our diagnostic and therapeutic techniques, a huge advantage to patients. The HDC NRW has been the university hospital of the Ruhr University of Bochum since 1989. The research capacities at the HDC come together in the Center for Clinical Research and Development and the Institute for Laboratory and Transfusion Medicine. Just how close theory and practice can be is aptly illustrated by the example of stem cell therapy and artificial heart research. The HDC is a pioneer in this field, considerably improving the situation of patients waiting for a heart transplantation. The HDC is also making valuable contributions to our understanding of the genetic fundamentals of diseases, such as cardiac insufficiency or diabetes. The HDC research findings are providing new perspectives on the treatment of these widespread diseases for physicians all over the world. This fruitful interaction between research and medical care is the basis for sustained therapeutic success. Increasing quality of life in people with cardiovascular and metabolic diseases. At the HDC, this is our top priority. Because patients with cardiovascular or metabolic diseases often have major challenges to overcome in their everyday lives, we take the time to prepare them properly for life outside the hospital. This includes not only organization of professional rehabilitation measures, but also seminars in which patients are taught how to cope with their diseases. But the specialist guidance provided by the HDC does not stop once patients are back in their familiar surroundings. Be it through organized activities, such as walking groups to get patients fit for an active and autonomous life, through regular medical checkups as a follow-up to hospital treatment, or through telemedical monitoring of vital medical parameters performed by experts at our very own Institute for Applied Telemedicine. Each measure is aimed at achieving the same major goal, namely, to give patients a longer life and a better life. What could be a greater plus for our patients?